Ever wonder if a medication intended to treat your depression or reduce your anxiety is now making you feel more flat? Like your feelings are muted or living life in grayscale. You're definitely not alone and you're definitely not imagining it. Today, we're diving into a common concern I hear from my patients, and that is, are medications dulling my emotions? So today we'll talk about what that means, how to tell if it's happening, and most importantly, what you can do about it. Hey everyone, welcome back to Shrink Talk with Dr. Robert, hosted by me, Dr. Robert, a board-certified psychiatrist. And today, I'll be discussing emotional blunting. What it is, why it happens, what to do about it. So let's get started. So to start off, is emotional blunting a real side effect, and what exactly is it? Just as an overview, emotional blunting is a phrase we clinicians use when someone's experiencing a narrow range of emotions, feeling that they have a hard time accessing both happy and sad emotions. Emotions are a part of the fabric of our life. It's what gives flavor to everyday interactions, experiences. So of course we want to be able to experience all of life. Though many things can cause this outside of just medications, but the meds used to treat depression, anxiety, and other conditions may also contribute to this experience. Often people describe it to me as feeling numb or like they just aren't experiencing the highs and lows of life anymore. For example, people may no longer be crying during the sad parts of movies, but not laughing at hilarious memes. I've heard it described by some patients as watching life rather than experiencing it and living it. So here's the catch-22. The emotional blunting I just described can also feel a lot like depression, loss of pleasure, disconnection, low emotional reactivity. Those are all symptoms of depression and other mental health conditions. So you can get into this sort of chicken and egg question of, is this the underlying condition or a side effect of the medication that is being used to treat it? Not always an easy thing to distinguish. Of course, in psychiatry, nothing is ever black and white. That means two things can be true. It could not just be the medication or the underlying condition, but sometimes it's a combination of the two. So maybe the depression's still there that in the first place caused a more muted experience of life. Now the medication is maybe helping some parts of the depression, but also making your emotional range a little bit more limited. So how to tell if this is happening to you and if it's caused by a medication or not? It's always good to ask your doctor about this or whoever's prescribing your medication and treating your mental health. Because it's also not just you, right? Your clinician should definitely be asking on follow-up appointments, not maybe every time, but often enough to get a sense of whether some emotional blunting may or may not be going on. There are also some good questionnaires out there. I often like the Oxford Depression Questionnaire. I don't go through it question by question with my patients in a very kind of formal way, but I do know the questions in there. So I kind of throw all of those in during the appointment to get a sense of, is this going on or not, if there's a question around it. Of course, it's just a questionnaire, just one tool, but it definitely can give us some good signal whether or not there's some emotional blunting going on from a medication. Of course, I always like to get a sense of a patient's emotional range before starting a medication. That way, if there are changes, I can look back at my notes and get a better sense of what was their emotional range beforehand, and could the medication be possibly contributing. And then, of course, that begs the question, which medications cause this? Before I get into that, I think it's very, very important for me to stress that this is not a common side effect. Most people who take SSRIs, which is millions and millions of people in the US and around the world, do not experience any degree of emotional blunting. Because I do occasionally get people who come to me having seen other providers who've been on the high dose of an SSRI and it's working, it's helping with some things, and unfortunately have this misconception, maybe from not getting good communication from their prior provider, that this is the expected result from being on this medication, which definitely isn't how it should be. Not experiencing full joy and happiness and having a more limited range of emotion is not the price you have to pay to not be depressed or overly anxious. The role of medication is always to make you feel more like yourself, never less like yourself. That being out of the way, which medications cause this most commonly? I would say probably most of the medications we prescribe have the potential of causing this. And those can be things like SSRIs, SNRIs, antipsychotics, mood stabilizers, among some others. Okay, and finally, what do you do if you suspect this may be going on with you? The answer is pretty easy. You bring it up to your provider, to whoever's prescribing this medication. And that's where I think it's also useful to be seeing someone that you feel comfortable speaking to about these things, right? Because if you can't bring up concerns around side effects with your provider, you don't feel comfortable, that could definitely be an issue. I think it's useful to suggest here that being more specific is also very helpful. So maybe saying, I feel weird or I feel off isn't as useful as saying, I'm noticing my emotional range to be smaller. I'm not crying at things the way I used to or laughing at things the way I used to. A good provider will always take that seriously. Some things we consider is maybe adjusting the dose of the medication, because maybe a lower dose was helpful without causing this. And I know it can be frustrating playing around with medications, but if these kind of issues do come up, it is always worthwhile making some adjustment to allow you to feel more like yourself. Bottom line is, you don't have to settle. If you feel like your medication is numbing your joy, your aliveness, your spontaneity, let's talk about it. There are always options and ways we can address this. Again, I can't emphasize it enough. All of our interventions, whether that be therapy, lifestyle changes, medications, they should all make you feel more like yourself or more like who you want to be, not less. All right, friends, thanks for hanging out for today's episode. I hope that was useful. I hope that kind of clarified this for you and gave you some sense of feeling maybe empowered as to how to address this if you think it's a concern for you or someone you know. Let me know down in the comments below if you've ever had struggles with this or experienced this as a side effect or had any questions about this. All right, and I'll leave you guys with the parting words of, emotions aren't things to be fixed. They're a signal to be listened to. All right, friends, like and subscribe, leave comments down below. I really appreciate the support, and I'll see you next week.